a holistic doctor. I'm CEO of a small but quite bold in vision Centre for Integrative Medicine in Bristol, and a sister organisation to the College of Medicine, because we're really wanting to be part of this transformation of healthcare. And, you know, I know that integrative medicine is about bringing together conventional, lifestyle and holistic approaches, but it's also about lifting patients out of this crossfire, this polarity about what's in and what's out. And with an empowered model, we need to empower our healthcare professionals to understand that model. So integrative medicine, I feel, is about taking a rather burnt out, frustrated healthcare professional into a happy person. And it's the same, the mirror is there for the person as well, who might be faced with a long-term condition and wants choice, wants to look at what is out there, what could I use, what suits me, what do I already use that helps me. So a team of us designed this 2-year diploma. It's Master's Level 7, supported by Crossfields Higher Institute of Education, an unusual organisation that looks at unusual education offers. And it's blended, so it's online a lot of the time, but with lots of face-to-face, 3 a year within, so 6 in the 2 years. And we've looked at different modules. So we've got philosophy, history, the changing times in medicine. We've got lots of approaches related to conditions, so Ayurveda, acupuncture, you name it, it's in there. If it's not in there, we want it to be in there. And crucially, we have holistic consulting as the absolute bedrock. So I was loving finding out all about the daughters of Asclepius. You'll know all about this, Eleni, but I didn't. So we've got, Hygeia, the goddess of hygiene, but we've also got the goddess of the glow of good health. Don't we all want that one? But again, the idea that from history we can look at what we might have lost in terms of these concepts of healing, but also of balance, this idea of the male and the female. And just connecting people to the NHS 5-year forward view, saying we want an empowered patients, and yet how do we empower people? So with holistic consulting, we look at compassionate and sensitive listening, engaging hopefully, exploring fear. These are all of the things that we study. We also look at holistic assessment tools. We have Catherine talking about the Penny Braun wheel, but also the holistic assessment tool. Very simple things like, I wonder why you got ill now. What might have predisposed, what might perpetuate, what might precipitate. The 3 Ps, if it rolled out across the NHS, it would be very, very different consultations. And with the approaches, as I've said, in relationship to conditions, we have everything in there. We focus quite a lot on nutrition because we believe that is an absolute key way to transform health and healthcare. But we might talk about green care. I was told not to be a tree hugger, but I do like this picture of someone hugging a tree. The idea, simple ideas, we're hardwired to feel more relaxed in the colour green. Just knowing that, we're going to recommend to our patients that they get out there. And I know that with lifestyle medicine, for example, the British Society of Lifestyle Medicine, a lot of doctors can really take those things on, like nutrition and lifestyle. But for me, it's a lot of the holistic approaches that bring this underlying model of wellness and of balance and of rejuvenation. And that's why, for me, the diploma is so important to gather all of those 3 aspects. But it's great to see research, which we look at in our critical appraisal. This is an article in the complementary Integrative Medicine for episodic migraine coming out of America, but looking at butterbur, looking at feverfew, magnesium, so looking at the research. So we really encourage our learner group to look at the research in a very rigorous way. But with IM 705, we broaden holistic consulting into holistic management and then connecting to social prescribing. And I have to say, the learner group have loved going to find out all of the social prescribing initiatives, going to meet council members, College of Medicine council members, all of whom have their innovative practices. And this is the Brighton Health and Wellbeing Centre, beautiful pink and blue chairs with an amazing arts programme. So they go out, they study that, and then that becomes part of their assignment. So they've been looking at dynamic practices. The Royal London Hospital for Integrative Medicine, one of the learner group, went up to Glasgow Centre for Integrative Medicine, meeting Michael in Columpton, a whole range of healthy living centres, some of them in Bristol. And it's all about inspiring them to a future. They become pioneers. One of them has already set up a centre for integrative medicine. Others are looking at how they're reinvigorating their general practice. We've had radiographers, we've had nurses, we've got a pharmacist wanting to apply this year. And actually we've had so many CAM practitioners who've wanted to do this diploma that the next job for us is just to look at the content within the diploma so that we can support CAM practitioners into this diploma as well, but also create this middle ground where we can interact, interface, and crucially find mutual respect across this whole range of approaches. So, the diploma. Thank you.
Thank you so much.